This is our first ever summer education series. I'm Teresa Spellman, the president of the HDSA Greater New York City Chapter of Volunteers. We're here to support our local community. And over the course of the summer, if this is your first time joining us, we're hosting a bunch more of these events with Columbia University's HDSA Center of Excellence in New York City. We encourage you to submit your questions ahead of time each time you register for these events, or visit our social media at HDSA GNY. For the presentation today, I want to encourage you to ask questions via the anonymous chat, and we will do our best to answer those at the end of the presentation. Before we begin, I just want to mention a couple of items. One, the HDSA Center of Excellence at Columbia University would like you to know that they're actually open for telehealth visits by appointment most Fridays and in person for new patients on August 14th. FYI, the contact information is on the last slide of the presentation, and the Center of Excellence is actually now open for clinical trial visits on site. If you have any questions about the studies, please contact Paula Wasserman, if you don't have her information already, at 212-305-4597. Now I'd like to introduce our speaker for today. We're really lucky to have Dr. Ash Rao. He directs the Occupational and Physical Therapy Program for the HDSA Center of Excellence at Columbia University. He is a professor of rehabilitation and regenerative medicine in the Department of Physical Therapy and the Gertrude Sergevsky Center at Columbia. Dr. Rao is an occupational therapist and movement scientist, and he has worked in HD for over 25 years, initially at Terence Cardinal Cook, and for the past 18 years in the HD Center of Excellence at Columbia. We're especially fortunate to have him at the Center of Excellence, as he is an equally accomplished clinician and researcher. As a clinician, he routinely helps our families with determining best methods for staying safe in the home, evaluating functioning, tips and exercises to improve or maintain independence and quality of life, and frequently provides supporting documentation for crucial assistive devices or equipment that allows individuals to remain at home, which we know is really, really important with families of HD. His research involves examination of sensory motor impairments in neurodegenerative movement disorders to understand mechanisms of underlying motor impairments to design and test novel rehabilitation strategies. He's conducted extensive research on motor changes across different stages of Huntington's disease. And Dr. Rao teaches occupational therapy, physical therapy, and medical students, and has mentored several master's level and doctoral level candidates. He really is a cornerstone of the clinic, and we're happy to have him here today. Also, just some fun facts. According to many patients and other clinicians, they will tell you he is possibly the kindest person you will ever meet. One account of that that supports that is Paula noticed one of Dr. Rao's ties and complimented him every time he wore it. One day, Dr. Rao gave Paula a present for her husband, the tie that she always admired on him. So Dr. Rao is the kind of person who will literally give you the clothes off his back. And with that, I'm happy to introduce you to Dr. Rao, who's going to present information on fall prevention and home safety. Dr. Rao?
Thank you so much, Teresa, for that very humbling introduction. Thank you all for joining the HDSA Greater New York Chapter Summer Series. I keep telling people that I'm very fortunate to work with an excellent team of professionals. They actually push me to become better as a clinician and as a scientist. So I generally don't take credit for any of the wonderful things that you just heard. So today I'm going to talk about fall prevention and home safety and some of the strategies that we recommend for families at the center. The objectives of today's presentation are basically, we'll ask how common are falls for people with Huntington's disease, and then what factors lead to falls, and importantly, what can we do to prevent falls? And we'll look at both personal factors and environmental factors. So how common are falls? Um, for people living at home, research has shown that the percentage of falls ranges between 36 and 65%. And for people living in nursing home, fall rates are about 50%. So as you can see, fall rates are quite high, and unfortunately, falls are a very common consequence of people living with Huntington's disease. In terms of some of the factors that increase risk for falls, we'll start with a discussion of some of the personal factors. And this is a follow-up of what you may have heard in the previous talk given by Dr. Lori Quinn, the physical therapist at the center, who focused her talk on exercise strategies, and she addressed some of these issues as well. So in case you missed her talk, I would encourage people to go to the HTSA website for the recording. So we know that muscle weakness is associated with an increased risk for falls. And our strategy is to work on strengthening muscle groups. And three examples of exercises that we frequently recommend at the clinic include squats, which is shown in the picture on the left here, lunges, which is shown in the picture in the middle, and heel raise and toe raise, which is shown in the picture on the right. In addition, we recommend improving core strength because that helps to reduce fall risk. And again, three examples of exercises that we recommend include bridging, which is shown in the picture on the top left, plank, which is shown on the picture on the right at the top, and Superwoman or Superman, as the case may be, at the bottom. And all these three exercises definitely improve core strength. In addition, we also recommend focusing on improving flexibility. So it is very important in any exercise program to do stretching at the beginning and at the end of the exercise program. A lot of our families have reported that they like going to yoga class because that focuses on flexibility and strength, among other things, and is a very good way to improve flexibility. In addition, and this is following what Dr. Lori Quinn mentioned in her talk, is improving aerobic capacity, which is very important to reduce fall risk. And perhaps the best exercise that we could recommend is walking. Some people prefer a stationary bicycle or a treadmill or elliptical. And again, several people report that they enjoy participating in a group dance class, although that hasn't happened in the past 4 months. Hopefully we can return back to group classes in the next few months. Equally importantly, we focus on improving balance exercises, either through prescribed exercises to improve balance or yoga poses that improve balance. And you can see a few examples shown here. So on the left is the tandem stance, standing with one foot directly in front of the other. A semi-tandem stance is shown here in the second figure. Single leg stance is shown here. And then the tree pose, which is a common pose during most yoga classes to improve balance. In addition, some other things to consider is attention, because that sometimes a lack of attention or the difficulty with focused attention also results in increasing fall risk. Impulsivity is very important because sometimes families report that people with Huntington's disease tend to get up from a chair or tend to sit down from a standing position impulsively and very quickly. And sometimes that itself results in increasing falls. It's also important to consult your physician, either your primary physician or neurologist, to go over the list of medications to inquire if any of the medications have side effects that may increase dizziness. It is also very important to consult with us at the center for prescription of either physical therapy or occupational therapy for a focused exercise program on falls reduction. The important message is that we recommend that people make exercise part of our daily routine. And I often work with families to create a weekly calendar of activity which includes exercise as part of daily routine. In addition to these personal factors, environmental factors also have an impact on fall risk. So in terms of the environmental factors, it's important to assess lighting in the living areas to ensure that lighting is bright and consistent throughout the living areas. It's very important to avoid areas of bright and dim light. If you happen to walk out on a sunny day from a dark room, suddenly notice that the change in lighting leads to changes in vision, which could increase the risk for stumbles and falls. It's important to ensure that surfaces within the living area are level, that there are no changes in level. And when there are changes in surface texture, it's important to enhance the visual contrast. And when there are steps either just outside the home or in the home, it's important to ensure that the step height is consistent. And at the edges of the step, sometimes we recommend that people put a white tape to enhance the contrast so that people can easily see the edge of the step to avoid tripping. In terms of the living areas, as much as possible, we recommend that people place furniture close to a wall, which allows for adequate space to walk within the room. And we recommend that people remove coffee tables or small side tables, as they can sometimes become obstacles. It's important to remove cords and throw rugs from the floor because, again, they tend to become obstacles in the walking path. Similarly, in the bedroom, we often recommend that the bed be placed next to a wall. It's important to have a stable bed frame. Sometimes we might recommend that the mattress could be placed on the floor as an option, and some of our families have actually found that very helpful. Just like the living areas, it's important to remove throw rugs and cords from the floor and remove small furniture from the walking path. Sometimes we find that it's beneficial to consider removing the closet door because often people report that falls or stumbles happen when people are trying to manipulate the closet door. And it's important to organize items within easy reach. So here in the picture is an example of a closet that's been wonderfully organized, and the doors have been taken out for easy access. Within the bathroom, while it is important to have adequate space, this may not always be possible in urban apartments. In general, we recommend shower stalls because they tend to be more safe option than bathtubs, although we recognize that that's not always possible. In terms of modifications within the bathroom, in terms of the shower, often we assess and recommend either a shower bench or a shower chair so that the person can sit and shower. And that often we recommend the use of a handheld shower, which is shown in the picture here. Sometimes we recommend having a bar soap on a string or soap on a sponge, and some of these sponges actually come with a strap so that the person doesn't have to hold on to something. In addition, as you can see in this figure, there are a number of safety bars installed in the shower area, which are very important to prevent falls. In terms of the toilet seat, might be important to consider securing the toilet bowl to the floor, and this may be particularly important for individuals who have a moderate or high amount of chorea. A raised toilet seat is beneficial, particularly for those who are taller, because it facilitates ease of transition from a standing to a sitting and sitting to a standing position. And it might be important to consider safety bars around the toilet as well. In terms of meals, we recommend good sitting posture, which includes sitting on a stable chair at a dining table for all meals. Sometimes we recommend that the chair be placed such that the backrest is close to the wall. Very important, we recommend that people remove distractions such as televisions while eating their meals, because we find that when people eat their meals and they're watching television, that can result in an increased risk for swallowing difficulties. If people experience difficulty swallowing solid food, we recommend that the food be cut into small pieces. And one strategy to slow down the process of eating is to put the spoon or fork down after each bite. At the center, we often do an assessment in order to assess whether adapted utensils may be beneficial. And often we recommend either a travel mug or a sports bottle with a lid for liquids. We recommend built-up utensils if people report difficulty with manipulating small objects. Sometimes a scoop plate, which is the yellow plate here, that as an example, is beneficial to be able to scoop food off the plate, placed on a non-slip Dyson mat, which is very, very helpful. And non-glass utensils are important because that prevents breakage. Ultimately, the goal is to do a complete assessment of our homes to minimize environmental hazards. So sometimes I use a picture such as this to be able to identify environmental hazards to try to minimize as many of these environmental hazards as possible. So I'd like everyone to stay in touch. If you have any questions, you're welcome to ask questions now or contact me on the phone number listed here or the email address listed here. I thank you all for your attention, and we can take some questions.
All right, everybody, if you have questions, please submit them in the anonymous chat. We've got a great expert on the line, so feel free to ask anything that you have top of mind that Dr. Rao might be able to help with. It looks like we have one question. Are there any recommended devices to help with folks trying to get in and out of beds?
That's a great question. So it's individualized solutions. So we typically evaluate the person to find out why people are having a difficulty getting in and out of bed. If the reason is muscle weakness in terms of trying to turn and come up to a sitting position to get out of bed, then that's what we work with. If people report that they have difficulty perhaps rolling out of bed, then sometimes we recommend using guardrails. Sometimes we recommend placing pillows or wedge cushions that prevent rolling out of bed in the middle of the night. And so if people have specific questions, then we'll do a full assessment in terms of the causes for the difficulty and come up with individualized solutions.
We have another question around what is your stance on toilet/foot platforms?
So foot platforms can be beneficial to increase comfort in the sitting position. However, the foot platform actually makes it more difficult to then stand back up from a sitting position. And if left in place, it can also become an obstacle. So often we recommend changing the seat height, as I showed in the presentation, by increasing the toilet seat height itself to help assist the transition from sitting to a standing position and standing to a sitting position. So in general, I recommend the toilet seat height change rather than using a footstool.
Another question came in around, do you recommend using a walker?
Absolutely. For people who have difficulty walking, we definitely recommend using a walker. Again, this is an individualized solution. It depends from one person to the next. So we do a thorough assessment of their walking, of their balance, of their attention, of their ability to hold objects, because sometimes people might need a walker, but they may also demonstrate impersistence, which makes it harder for them to hold on to a walker. In general, the most frequent recommendation for a walker at the center is a rolling walker. And research from our colleagues has shown that a four-wheel rolling walker with brakes actually is the best walker because that helps improve walking ability.
Okay, we've got another question around where can safety bars be purchased? Do you have any recommendations there?
So often we recommend that people go to a surgical supply store. Often there are rehabilitation companies that we recommend or where we find products for families. So if you have any questions at the next visit to the center, I'm happy to work with families to find specific safety bars or other devices to help improve safety. But the first thing is, the easiest thing is to go speak to the person in a surgical supply store.
Okay, great. So far, it seems like that's all the questions. Are there any other questions going around once, twice? Apologize if you hear ambulance in the background. All right, I think that might be it, unless there's a delay. So just want to thank all of you for joining us today, and appreciate all of your time, and especially you, Dr. Rao. And it's been great collaborating with the Center of Excellence. So wanted to thank you for your time, but also remind folks that we've got 2 more exciting summer series sessions coming up. The next one is with Jill Goldman, and she's going to be talking about what to think about when you are considering genetic testing. That will be followed up with a session with Seth Rotberg, who is personally, I'm excited to really hear about what he has to talk about here for patient advocacy. He's a co-founder of Our Odyssey, and sure if you've ever been to the HDSA convention, you've seen him as well. But we're excited for these 2 upcoming sessions, and we hope that you'll join us.